Welcome to our weekly seminar sessions that we've been doing on COVID and. The and changes each week, what we add to COVID. This is our fourth one, and I'm really delighted that APARC, our main center on, our only center on Asian Pacific research, hosting today. And the director of APARC is Gi-Wook Shin, and I think I'll hand it over to Gi-Wook to get us started.
Thanks, Mike. Happy Friday, everyone. Thanks for joining us today. So we are very happy to present a panel on social and economic impacts of COVID-19 in Asia. As many of you know, Asia was first hit by the coronavirus and is now better geared to handle the crisis. South Korea and Taiwan, for example, have been very successful in containing the virus and are often praised by the international community as exemplary models to follow. South Korea even managed to hold its general elections last week as well. The crisis created by COVID-19, however, is still ongoing. And it's more than just a biological issue. It's also an issue of governance and political leadership, which have tremendous social and economic impacts on society and the people. So today, we have an excellent group of scholars from our center, APARC, who will be addressing these important issues for the region. First, Xuegang Zhou, a senior fellow at FSI APARC and professor of sociology, will speak on China. And Yong-Suk Lee, a center fellow at FSI APARC and also deputy director for Korea program, will be looking at South Korea. And then Dan Emerson, who's heading our Southeast Asia program, will speak on Southeast Asia. And then finally, Karen Eggleston, a senior fellow, also deputy director of the center, and also heading Asia Health Policy Program, will be talking about Japan and South Asia. So at the end of the presentations, Karen will be moderating the panel discussion and Q&A. So as usual, please send your questions to the Q&A box at any time during the session. So before turning to Xuegang, I'd like to direct your attention to our own series on COVID-19. So I'm going to share on our screen. So can you see this slide? Okay, so this is our series at the center dealing with COVID-19 in Asia. So we already have done on Japan and South Korea, but many more coming up next week and then weeks to follow. So here, okay, so please check our website for details and registration. So I hope that all of you can enjoy today's webinar. And then without further ado, let me welcome Professor Xuegang Zhou.
Thank you, Gi-Wook, and good afternoon to everyone. Now, China was the initial epicenter of this COVID-19 crisis. And at the very beginning, the Chinese government responded to the crisis in a very predictable way. That is to say, at the very first, it tried to sweep the problem under the rug. And only when it realized that the gravity of the situation never goes away, it responded in a way that only an authoritarian state could, by mobilizing its powerful organizational capacities to lock down almost all urban areas in China. So for more than 2 months, the entire nation was locked down. And by end of March, when different cities gradually relaxed restrictions, the virus spread was largely under control. And since then, economic activities have resumed gradually in different parts of the country. So in my short presentation below, I want to give you a timeline to highlight some key events, key moments in this episode. And I'll end with a couple of observations. I'm a sociologist, so I look at this episode in terms of how the government interact with the people there. So from this lens, I divide this episode into 3 phases. In retrospect, as we know that the coronavirus started in early December, but most people knew nothing about it until January the 20th, when the officials publicly acknowledged the contagiousness of the virus, and when the top leader Xi Jinping issued the call to mobilize to contain the virus. So the first phase was between the day the public announcement and February the 7th, which is marked by Dr. Li Wenliang's death. The first phase was really characterized by confusion, government paralysis, and turmoil. So 3 days after the public announcement came the lockdown of Wuhan with 9 million residents in it. In Wuhan, the lockdown decision created a turmoil. Tens of thousands of residents rushed to the hospitals for tests and treatment, and the medical staff were totally overwhelmed. In desperation, local hospitals bypassed the government administration and appealed to outside directly for help. And that was an extraordinary endeavor in the Chinese bureaucratic system. And after large donations of medical equipment rushed into Wuhan, it was poorly handled by the official Red Cross. And so the bureaucratic red tapes delayed and diverted to places that should not be there. So when government was in this way, the lack of NGOs created a huge vacuum for services or emergency response. And that, of course, exposed the serious problems in the centralization of authority in China, and complaints, petitions, and cry for help flooded the social media and led to the shocks and the public outcry all over the country. Now, on February the 7th, Dr. Li Wenliang died of coronavirus infection. By that time, Dr. Li's story was already well known among the Chinese. In late December, when the virus first surfaced in Wuhan, Dr. Li sent the information to his friends over social media. And for that reason, he and several others were reprimanded for spreading so-called the false information, and their punishment was broadcasted at national TV. So Dr. Li was subsequently infected, and his story was reported over social media all over the country. And then he died on February the 7th. And his death put a human face on this tragedy, on the outbreak, that triggered an explosion of emotion in Wuhan and all over the country. And that actually led us to the second phase, that is the early February to early March. During this period of time, resentment and criticisms became vocal and loud every day, and they spread all over the internet and other media outlets, calling for resignation and punishment of those officials who silenced the whistleblowers. One event became the milestone in this phase. I want to just give you some sense about it. On March 10th, a Chinese magazine published an interview with the very first whistleblower, Dr. Ai of Wuhan Hospital. That interview went viral on internet, and it was quickly censored and taken down by the official censorship. And that led to a huge resentment and uproar among the netizens. So they keep putting this article back onto the internet, and it was taken down again and again. And then the netizens got very creative. They put this interview article in different formats, in different languages, to defeat the AI censorship machine. In about 24 hours, more than 30 different languages and forms came out on social media. And these forms include in pictures, in reverse wording orders, in QR code, in audio, in Chinese pinyin, in Cantonese pronunciation, in ancient Chinese language, in oracle, in English, Italian, French, German, Japanese, Korean, Vietnamese, Hebrew, and in Morse code and in music notes. Now the netizens actually was joking that it took Harry Potter 20 years to be translated into 80 languages. But it took only 1 day for this article to be put into 30 different formats and languages. And no Chinese literature has ever received that kind of honor before. Now, I have followed Chinese social media for a long time, and I have never seen this kind of unorganized but concerted efforts in defiance of government censorship, and it really in the open protest. And this really signals in my mind a new era in China's social movement in the virtual space. So by early March, even though the crisis was subsided in China and gradually under control, the resentment and critique over how government handles this crisis was boiling to a very high level on the social media. Now, if we could pause history at that moment, we could say that this crisis would have a huge, shocking impact on China's governance. But of course, history continued to unfold into the third phase, and that's from the early March to the present. Since mid-March, of course, we know that crisis in Italy, in Great Britain, and in the United States broke out, and it showed how poorly prepared and effective that democratic governments were, and the huge losses they incurred in these countries. And especially considering the long time of observing what has happened in China since initial outbreak. So for many Chinese who really expect a much better government response in these societies, and they were shocked and dismayed. And in comparison, now the Chinese government looked much better in its handling of the crisis. So the tide and the mood on social media in China and all over the country have turned since then, and a wave of strong nationalistic emotions returned to social media. And it was subsided for a long time in the past few months, but now they came back. And those voices critical of the Chinese government's mishandling of the situation now almost mostly silenced. And that trend has persisted to date. So let me end my discussion with a couple of observations. First, I think we already recognize that to respond to infectious disease like the coronavirus, it requires huge mobilizational capacities, such as locking down large cities and large patch of residential areas. And of course, the strong state in China does have many advantages. But in other circumstances, in all other crises, the strong bureaucratic capacity may do more harm than good to its people. As it so happened in the Great Famine of the early 1960s in China. So we really need to put this episode in some perspective. The second point I want to make is that much of what has happened in China in the last few months, and both the voices of social media and really the heroic efforts of the Chinese medical professional in fighting this crisis has escaped the attention of the Western media. And the lack of attention, I think, created a huge void in our understanding what has happened in that part of the world. I think this neglect has contributed to what we are experiencing in the crisis in this country. So let me stop here and thank you.
Okay, thanks, Shiguang. Now let's go to Yong-Sok for South Korea.
Okay, thank you. Good afternoon, everyone. I'll be talking about South Korea's case. Let me see if I can get the screen up. Okay. And I'll do full screen. Oops. Here we go. Okay, So what I'll do is I'll first present some descriptive statistics, talk about the policy responses by the South Korean government, and then its implication towards governance and ultimately the potential socio-economic impacts that we see, what we can learn from South Korea's cases. So this is daily COVID cases in South Korea. As you may have widely heard in the media, South Korea has been very successful in reducing number of daily cases, and so-called have at this point seems to have flattened the curve, though we don't yet know whether there might be a second surge. So around mid-March, cases have reduced drastically after initial surges. Just to compare also deaths by country. So this is number of deaths over time in log scale. So the slope indicates the growth rate of deaths over time. So you can see major countries, and these are the general patterns: initially rapid increase in growth rates of death cases, gradual tapering off. But in the case of South Korea, it has been very slow from the beginning. And they've been maintaining low levels of deaths per day over quite a while now. So what I want to talk next is, okay, what was behind South Korea's relatively successful public health policy response to COVID-19? So first of all, there were several key aspects in terms of policy. Testing was one aspect. It was mass and early testing. At the beginning, even before the first case was identified in South Korea, the Moon administration gathered various test kit developers, encouraged them to develop kits and mass produce kits. And since then, it has been provided widely at a very low charge, or in many cases, free to the population. So most people, when they wish to, can get tested. Also, when a doctor was actually infected within hospital by a patient, what they decided to do is introduce outside testing, and that has been a major source of testing in South Korea, and many other countries have been following suit. Another key aspect is contact tracing, somewhat more controversial. Basically, if there is a confirmed case, all the information, where that individual has been at a certain point of time, is shared via website. The local government sends a ping to you on your phone that, okay, there's a new case nearby, and these are the places that this individual has been to. So if you wish to get tested or quarantine yourself, go ahead and do so. So these were introduced very soon after the first cases, and there were technologies, various companies that created various apps. So that's one aspect. And then another is obviously treatment. Government paid for the treatment. It was free for all confirmed cases, and public hospitals were important in actually treating patients. Confirmed cases were sent to public hospital. Private hospitals were a bit slower to accept patients. Less severe cases were quarantined into residential or training centers that were converted for primarily treatment purposes. And government also paid for the lost income based on a formula for those who were quarantined. So one key aspect, so there's these 3 T's: testing, tracking, and treatment, but also one key aspect of South Korea's policy was that there was social distancing like here, but there's no lockdown, no shelter in place. Basically, if people were willing to, they would go about on their daily lives. Obviously, it was a voluntary decision whether or not they would go out or not. Firms did maintain open door policies, but many were able to work at home. Another key aspect was that South Korea maintained an open border policy. So foreigner entry was not restricted. And this is a key difference from another successful case that we often hear about, Taiwan, where they basically shut down the door, especially to China soon after. All confirmed. So in the case of South Korea, the border was open, but there were testing centers set up in these borders. And whenever someone was tested positive, whether a foreigner or domestic, they would receive full treatment at a free of cost. So let's skip this one in the interest of time. So one thing that's, it's hard to tell whether there's going to be another surge, second wave of COVID cases. But there are several key factors that were important in these successes that complement the public health measures. First is that there was learning from the Middle East respiratory syndrome so this occurred during the last administration. It hit South Korea pretty hard. Mortality rate is about 20%. And since then, the KCDC, Korea CDC, has been planning on how to respond to the next outbreak. It implemented policies swiftly and decisively. And the picture up to the right here is of the KCDC director. She was actually one of the most trusted individuals during this whole period. There's actually a Wall Street Journal article about her. Her consistency, devotion, and confidence actually gave the people direction and sense of responsibility to participate in various social distancing measures. So leaders in times of crisis are important, and in some sense, rather, instead of the president per se, this career administrator was sort of the leader that actually helped people guide through this pandemic. And there are health professionals working around the clock to control the spread. There were enormous efforts by government officials. There were actually a sad case of a health government official dying because of overwork, but it was a devotion by these people that actually helped mitigate the whole pandemic situation. Transparency was key in South Korea. The previous government, so this was a point raised during our talk this week by New York Times journalist Choi Sang-un. The previous Park administration failed drastically during the Seoul ferry disaster where 300 students had died. And the government knew that showing how the government can transparently deal with these disasters were important. And from the beginning, that was a key aspect that they tried to maintain transparency and information sharing with all the public. And that helped build the social consensus, whether it's related to contact tracing or abiding by social distancing or wearing masks. Obviously, universal public health care is a key aspect in times of pandemics like this. And civic participation, volunteerism also increased, which is also related to government's transparency as well. So this was actually exemplified by the National Assembly election last week. They held the election, midterm election, and voter turnout was very high, 66.2%. And in some sense, it itself was approval of the government's handling of the crisis, but it also exemplified how people trust the government, but also other people. And it could be even said that COVID-19, in the case of South Korea, has bolstered civic responsibility and democracy. But now, what lies ahead? What's going to be the consequences? What can the government do? This is an ongoing situation, so we don't have the right answers. So what I'll do is I'll just present some data points and talk about the potential implications going forward, and briefly introduce some of the stuff that I've been working on. So this is from the OECD, and trying to get as recent data as possible. I drafted this up, looked it up yesterday. In terms of GDP, not many countries have reported the first quarter GDP numbers of this year. What we see here, we heard probably from the news that some of you may have heard that China's GDP contracted about 10% compared to the previous quarter. South Korea released the numbers a couple of days ago as well. It contracted as well, but it's substantially smaller at 1.4%. In terms of unemployment rate, so 3 countries in the OECD reported unemployment rate for March. Canada, as you can see, shot up very high during the month of March. US, we know that it has increased. It's 4.4% as of March. We expect that number to jump in April, as we've seen in this unemployment filings, benefit filings. In Korea, it also increased, but the increase has been relatively smaller. So it's obviously hard to tell, and we can't generalize. But just based on some of these evidences, it could be said that foregoing a lockdown policy or a shelter-in-place type of policy and allowing people to go about their businesses, but rather pursuing contact tracing from the onset at a very early stage, because of that, South Korea may have been experiencing a less negative economic impact up till now. But going forward, it's hard to tell. Because ultimately what's going to matter in the coming months is people's confidence and firms' confidence in the economy and their perception. So these are OECD numbers again, General Consumer Confidence Index, Business Confidence Index, and basically compare a number less than 100 implies that the situation is worse than a long run average. And that number has been going down in many countries. The US has been slow to go down, but as you can see, Korea in March has been constantly decreasing regardless of whether the cases have been decreasing or not, and it's dropping considerably. Now, because there are some limitations of examining cross-country evidence, this could be driven by COVID-19, but also different cultural aspects, optimism, government policy, etc. Here I'm pulled some data from South Korea, a most recent survey. And one thing I wanted to examine, and I'm interested in, is, okay, what are people's expectations in terms of spending? Will this actually depress consumption, so whether a recession is induced from the demand side or supply side, we can't tell, but consumers will play an important role. And this is basically asking people, what do you think your spending will be like 6 months ahead relative to now? And now being March 10th to 17th in this survey, which is actually after the peak in South Korea and somewhat when cases started to stabilize. But still, it was soon after the major peak cases in South Korea, so the sentiment couldn't have been very good. But what we're seeing here is all the numbers are quite low, regardless of age group or income. Below 100 implies that they believe that they'll be spending less. And the lower the number, spending considerably less than today in March. And we can see that it's more so for the case for the older population, 50s or over, or more so for those with lower income levels. So this potentially has implications, first of all, that, okay, demand will likely be depressed long run from now, even 6 months, midterm, I would say. And then also it suggests that there could be unequal consequences to different age groups or income groups going forward. So one thing to brace for is the effect on inequality from this pandemic. So South Korea's case provides some insights, I'll be wrapping up pretty soon, on what the economy might look like after the curve flattens, whether COVID-19 will induce long-run behavioral changes or firm reduction in investment, we still have to see, but we can't rule out that there could be a long-term demand-induced recession if these behavioral changes happen. The Korean government, like many other countries, are initiating policies to revive the economy. The effect of those remains to be seen. In terms of what I'm doing right now is I've been collecting some very fine data. So because South Korea has been actually doing contact tracing and they've been very transparent about this, I've been collecting this data on where the patients were actually confirmed, where they've been to, and trying to examine what at a micro level or more of an aggregate level as well, the impact of COVID-19 on businesses and employment. Another aspect that seems interesting is, okay, how, as we've seen, we're doing a lot of things online, and this behavioral change might become sticky in the sense that even after COVID-19 subsides, we might adhere to certain behavior that was different from before, and that could actually be revealed in how urban population dynamics change over time. So I'm focusing on Seoul right now, gathering data on very detailed information of population movement across areas in specific time over space. And one thing also that we expect to see is that this will change technology adoption in firms, type of work, how we work, and how firms will manage work. So those are some projects that I've been working on, especially related to nursing homes with Karen Eggleston. We're examining how this will change nursing homes, which were impacted, unfortunately, devastatedly in this situation. So with that, I'll wrap up just my comments related to South Korea and then turn it back over. And I'll stop here. There we go.
Okay, thanks, Young-suk. Now let's go to Dan Emerson for Southeast Asia.
650 million people live in 11 different countries, very different countries in Southeast Asia. I would argue that no region in the world is more diverse than Southeast Asia. Now, from an analytic standpoint, from the standpoint of someone who is trying to explain why some Southeast Asian countries have done better than others in dealing with COVID-19, that diversity is both a blessing and a curse. It's a blessing because it gives you a large number of independent variables from which to choose in order to explain relative performance in dealing with this crisis. On the other hand, it's a curse because you can't control. It's very difficult to control for unwanted variation that's going to contaminate your argument about this particular variable being the primary cause of either effective or ineffective governmental performance in Southeast Asia. So I want to begin with that. And also I want to add another problem with the diversity of Southeast Asia. And this is a diversity I could go on all kinds of dimensions, political, economic, you name it, cultural, religious, historical. And that is that this diversity tends to impede the ability of the region to speak as a region, and particularly the Association of Southeast Asian Nations to act effectively as a multilateral response, right, to this particular crisis. It is appalling, in my opinion, that it was not until the 7th of April that the ASEAN foreign ministers even met. And yet you would imagine that they would have met in January, okay, maybe in February, in order to launch some kind of coordinated, concerted effort to respond to this crisis. So that's one of the disadvantages of diversity. And also I want to contradict what I've just said by saying that there is one lack of diversity that further impedes a particular explanation for relative performance. And that is the lack of liberal democracy. There are no liberal democracies in Southeast Asia. There are a couple that might be called, as The Economist does, flawed democracies. But by and large, the regimes in Southeast Asia, let's put it this way, are relatively authoritarian. And so when we make the argument that authoritarian governments do better than democratic governments, or vice versa, we run into the problem of not having enough variety in Southeast Asia. After those comments, let me just construct a scale. This is a little bit invidious. Here am I, not even in Southeast Asia, not a Southeast Asian by birth or citizenship, arranging countries, right, like grading them like I was a professor, right, and they're the students. So that's quite embarrassing, but nevertheless, I will go ahead and do it. In my opinion, the two countries in Southeast Asia that have been most effective in responding to the crisis are Singapore and Vietnam. Singapore has a footnote that I'll note in a moment. And the two countries that have done the worst, to the extent that we have evidence, and it's important to mention that the evidence is shaky for many of these countries, the two countries that have done the worst are Indonesia and the Philippines. Now, I have to say one more thing about the reliability of data. In the case of Laos and the case of Cambodia, those are two countries that to this very day claim 0 deaths, no fatalities from the virus. Laos is probably the most authoritarian country, in some respects anyway, in Southeast Asia. And its data are questionable. And I frankly, personally doubt very much that there have been no deaths in Laos. And if the data is that bad, how can we really put them on the list with any kind of confidence, up or down, in terms of their relative effectiveness? In the case of Cambodia, Hun Sen, the prime minister, very authoritarian, a dictator. Hun Sen has responded to the virus with China in mind. We heard Shui Gang talk about the background of how this happened and grew up in China and the extent to which China filtered, let's say, to use maybe a euphemism, filtered the information. Hun Sen owes so much to China and has tilted his country so much in China's direction that one of the first things he did in February was actually to go to China to meet with Xi Jinping, to show the world that he didn't care. No, he was there, not, you know, I mean, in other words, he even went so far as to prohibit Cambodian students from evacuating Wuhan. during the crisis. So in any case, that's an exceptional case. I won't go further on either Laos or Cambodia, except I've just explained why I'm not going to include them on the list. All right, let's go to the list. Let's start with Singapore. 12,075 cases, positive cases of infection in Singapore. This is the most in Southeast Asia. Now, one could argue, well, then why are they at the top of the list? That sounds like this should be worst. But on the other hand, we know that the ability to determine who has it and who doesn't have it represents a capacity that can be used to flatten the curve, right? As we're all talking about flattening the curve here in the United States, the same logic can apply to other countries. And there have been only 12 deaths in Singapore, which is pretty good out of 12,075 cases. Having said that, I do want to put the footnote in to make it clear that the recent news from Singapore has been bad, quite bad. Nearly 1,000 cases have showed up in dormitories occupied by labor, transient labor coming in from outside. These are migrants, right, who are at the bottom of the social structure, the social hierarchy in Singapore. And I have to say, one in fairness must be critical of the Singapore government for having ignored that and concentrated rather on those in the social classes that are higher up within Singapore. And so that is a serious drawback to the Singaporean record. But the other thing I want to say, which is of course really important, is that of all the countries in Southeast Asia, none has approached the virus with a more technological, not just technocratic, but high technological array of instruments. When it comes, for example, to tracing contacts. In Singapore, it's all an app on your cell phone, right? They don't need to send somebody out and sort of follow you down the street and see who you talk with, right? And who you might hug or not hug. No, it's all done electronically. I could go on in that vein, except to say that one of the reasons for Singapore's success is its use of technology. And also, and this is something we sometimes overlook, frankly, there's an important variable here in trying to explain relative success across countries, and that is to what extent is the population willing to obey the law, willing to do what the government wants them to do. And Singapore's population is renowned for its ability to do that for various reasons, only one of which I'll mention, which is that Singapore is a very small place, a very vulnerable place. It's jammed between two large countries of majority Muslim character in terms of religion, who differ in other respects as well. And I think there is a sense in which Singapore has a kind of optimal insecurity, which enables the government easily to convince the population that, okay, now it's time to observe, let's say, social distancing. That's an important aspect of that situation. Moving on to Vietnam. In Vietnam, you also have a mobilization of the population, but it's not done so much through high tech. It's done through the power and force and prevalence and network of the Communist Party of Vietnam. If someone in a neighborhood reports that someone else looks like they might have the virus, then it's not a question of a phone app. It's a question of someone employed by the party, by the government, coming in, knocking on your door and finding out if you do, or if you're coughing or exhibiting other symptoms, in which case, if you have not been frank about your condition, you may end up in some kind of containment, right? Perhaps a containment that you don't want, but you have no choice over the matter. So I think of all the countries in Southeast Asia, it's Vietnam in the authoritarian sense, its ability using old-fashioned methods to impose order on its society in defense of life and so forth, facing the crisis is really terrific. I mean, I should mention one other thing. A province north of Hanoi was completely shut down for 3 weeks in February. This is equivalent to what happened in Hubei, right, in China. No other Southeast Asian country could accomplish that. Okay, moving quickly to the bottom, and one other thing, which is that both Singapore and Vietnam had experience of SARS. So if in your own history you've had the experience of locking down, as it were, it's easier to do it a second time. Moving to the bottom of the list, Indonesia and the Philippines, briefly, I don't have a lot of time. In the case of Indonesia, 8,211 cases. That's the second largest number in Southeast Asia after Singapore. But the difference is the deaths. 689 deaths, the most in Southeast Asia, have taken place in Singapore. In the Philippines, 7,192 cases. That means that they're right after Indonesia at the top of the list in terms of the number of cases. 477 deaths. They're the second most after Singapore in terms of the fatality rate. So those are reasons why one might want to put them at the bottom of the list. Both of these countries responded late. We know in the United States in the debate that involves the governor of Georgia, right? The tension that exists between, let's put it this way, longevity on the one hand, human health, economy on the other hand, employment. We want to get back to work, right? And that tension shows up in countries throughout Southeast Asia. In the case of Indonesia, the president of Indonesia, Jokowi, Joko Widodo is his full name, responded in a way that is at least consonant, understandable in terms of his own personal biography. He, in his pre-political career, was a furniture salesman. He was all about the market. He was a businessman. And that carried over into his presidency. He responded very late to the crisis, to the crisis. He was primarily concerned in his relations with China about bringing in the kind of connectivity, the Belt and Road Initiative. He was loath to criticize China for the crisis, not as loath as was Hun Sen in Cambodia, but still, and essentially refused to believe the seriousness of the problem until enough had already happened that it was much harder to try to take care of it. And now, one other comment, and I'll leave Indonesia there. It's interesting that although Indonesia is by no means a federation, it is nevertheless from the provinces who are there right, in the kitchen, as it were, or in the mortuary, to put it rather more bluntly. They can see the effects of the crisis and what's happening to them. And they have actually pressured the Indonesian government to do more and more, if at all possible. And even the split between President Jokowi and the governor of Jakarta, which is another matter, has slowed the ability of Indonesia to respond effectively to the crisis. And then finally, the Philippines, briefly, there's so many variables that plug into an explanation here of relative success. One of them is the personality of the leader. In fact, I've already mentioned that in the case of Jokowi. In the case of Rodrigo Duterte, the president of the Philippines, that variable is of extreme importance. He has got a relationship with China which makes him unwilling to anger China, not to the extent of Hun Sen, but still. And he frankly did not take the crisis seriously at all. In some ways, if I may say this, and this perhaps may sound like a partisan comment, but I'm trying to speak as a scholar nevertheless, he is rather like Trump. In one speech, he told the Filipinos, you would be fools to think that you should not gather in crowds. No, forget that. That's outrageous. Don't do that. And then days later, he turned around and locked down the capital of his country, Manila, and the entire island on which it rests, namely Luzon, right? His policies have been chaotic, they have been inconsistent and self-contradictory, and that's one reason I think why the Philippines ranks at the bottom of the list. Now, the final thing I will say is this. As I said, I signaled at the beginning that I cannot draw from this comparison any generalization about the relative efficacy of authoritarian or democratic rule. But I will say this, and maybe this is even the lesson that one can draw more broadly with regard to other countries elsewhere in the world. It may not be the regime that matters in terms of how accountable it is, but it is certainly the case that competence, governance, rather than liberal democracy or illiberal democracy or authoritarian rule, governance is really what matters for all of us if we are to come out of this crisis as soon as possible.
All right, thanks, Don. Let's go to Karen on Japan and South Asia, and then you can moderate the panel. Thanks.
Great. Thank you very much, Kiwik, and thank you all very much for joining us. We hope you are well. I will talk on behalf of the Asia Health Policy Program and the Japan Program and our South Asia Initiative and try to leave some time for Q&A. We live in very uncertain times, and amid this deep uncertainty, I'll just offer a few quick perspectives from research on comparative health systems. Health systems are far more than universal health coverage for medical care, as important as that is. Health systems are deeply interlinked with the economy or the demographic trends of the societies that they serve. And while health systems are generally far stronger with higher per capita income, there is wide variation and for any given level of economic development and no clear correlation between regime type and investment in strong health systems. Even otherwise solid health systems can be strained by pandemic, and preparation matters. You've seen, for example, East Asia invested after SARS and MERS. And if SARS in 2003 had been SARS-CoV-2, things actually would have been even worse than they are now. And lockdown versus livelihoods trade-offs, if we think that's excruciating here, it's especially so when the majority of the workforce is in the informal sector, such as in South Asia, reinforcing the importance of the social determinants or non-medical determinants of health. Of course, investment in strong healthcare system infrastructure matters. Just as one example of the disparities across the region and the world, I show here beds per capita. We can see India, half a bed per 1,000 population, Japan over 13 beds per 1,000 population. And it's difficult to measure how much you can access the healthcare and the quality of that. Here's one attempted metric to show, to which some other FSA scholars have contributed. And it shows progress over time, but deep and abiding disparities. Compare again, Japan and India. So the residents in low-income countries face a double disadvantage from lower income, lower education, and weaker health systems. So that even those on the margin of the middle class face the threat of illness-induced poverty or being one hospitalization away from destitution. If you look at COVID-19 in Japan, it's unclear how things will unfold. Even strong health systems can be strained by a pandemic. We had our first cases in January, the Diamond Princess crisis, postponed the Olympics in March, national emergency now. In the coming weeks and months, perhaps dealing with the second and third waves, doing more testing. They have a strong health system, but they also are leading the world in terms of the demographic transition and have the oldest age structure. And there have been a few clusters of cases in nursing homes. Of course, they're trying to avoid more. We've seen the devastation that that can cause. As Young already mentioned, related research is about technology in nursing homes. And one question it raises is whether robots or other technologies can help to avoid the devastating pandemic spread among institutionalized populations in many parts of the world, enable humane care and social connection despite physical distancing. But that's one reason why the share of the population age 80 and older matters now and in the future, and its level and pace of change vary greatly across Asia. Only years from now will we know or have good measures of the true excess mortality during the crisis. But we know older patients with chronic disease are clearly more vulnerable. It's not clear whether the pandemic will derail longer-term trends toward healthy aging or endanger intergenerational social contracts in these societies. Among the younger economies of South Asia, already there's a humanitarian crisis likely to exacerbate disparities. Will there be more deaths from COVID-19 or from foregone healthcare and vaccinations for other infectious diseases and lost livelihoods, despite some offsetting effects from lower air pollution and fewer traffic accidents? So some of my own research with colleagues in the region is about trying to understand that foregone healthcare. Consider India. There are large differences in health burdens and strengths of the health systems across the states of India, each of which is more populous than many countries in the world. As this shows, darker blue have better health outcomes from less infectious disease and malnutrition and more from chronic disease. So look at Kerala down at the bottom there. You can see it was blue even earlier. So that shows that in large economies, it matters the strength of the local health system. It's not clear yet how devastating the pandemic will be in India and other parts of South Asia. But Kerala has had a strong health system and has shown alacrity in deploying contact tracing, isolation, and surveillance. What we heard about that they were deploying in Korea is being deployed in Kerala. Other parts of India are less well endowed or able to respond. The lockdown led to impossible flocking, trekking long distances. Only in the coming weeks will we know the longer term implications of the lockdown with variation in testing, social impacts across the region, maybe some initial positive effects of the lockdown. There are heart-wrenching headlines about hunger and uncertainty. Other densely populated countries in South Asia are trying to walk the balance between curbing the coronavirus spread and avoiding economic collapse. COVID-19 by province in Pakistan, the current situation in Bangladesh. We will hear from other experts in Asia during an Asia Health Policy Program webinar on May 27th. I invite you to join for that. We don't have time to talk about the rest of South Asia. Finally, let me close by pausing on historical perspective. With this telling graph by prominent demographers years ago, showing broken limits to life expectancy since 1840. Looking back at the remarkably linear increase in world-leading life expectancy since well before the previous large pandemic. Some of the same countries are now were leaders then: Iceland, Norway, New Zealand. Parts of Asia have caught up, and Japan is world-leading over the past several decades, and is the first largest country, over 100 million, to achieve that. But how we respond now will determine whether these trends continue, and perhaps more importantly, whether the rest of the world can catch up. So much remains unclear, but one thing is certain: the health systems of Asia matter. They're shaping the 21st century, not only for the majority of humankind that lives in Asia, but for the rest of us as well. So thank you for listening. Thank you to my fellow panelists. And now we will turn to your questions. I will moderate the questions, and we welcome your input. Put them in the Q&A. So first question, maybe we'll link back to last week's seminar where it mentioned the election in South Korea, and I'll turn it over to Gi-wook and Young to talk a little bit about whether, how they were able to pull off the election during the pandemic, and whether you think that had to do with the crisis or other long-term trends. Please, Gi-wook and Young.
Young, you can go ahead.
Well, I think, like I mentioned before, I think the main thing was that, first of all, I think Larry pointed out this question of there could have a different perception on liberal democracy declining in South Korea up until this case. But what we've seen here is enormous amount of civic participation and in some sense solidarity among the people. And I do think the one thing that they did well was delegation to deputy who had career experience. Rather than making this situation political, I think what South Korea was able to do is try to become apolitical, at least successfully convey that image by making Chung Eun-kyung, who was the director of the KCDC, out at the front and let her do her work. So I think that was a big success overall, and a good big motivation that actually helped people perceive the whole situation in a more objective manner. So that's my perspective, but I think I'll pass it off in a different.
Okay, so I think that's kind of related to Dan's comments about governance. I think what happened in South Korea is not really about democracy, versus non-democracy. It's more like governance issue. And South Korea was acting like a developmental state. So I think you can see certainly legacy of developmental states who has a very strong and very effective way of governing the country. And if you look at the voting in a booth, I mean, they have the very very well, actually. They are checking, temperature. You have to wear your mask, and you have to maintain social distance. So everything was done, very effectively. And I think once again, it reflects the legacy of a developmental state. It's not really about democracy or non-democracy.
Thank you. There have been several questions about the accuracy of the data and transparency in China and so on. Xiaogang, you've answered some of that. Maybe you could speak a few minutes for everyone about your answers. Xiaogang, you have to unmute yourself, please.
Yeah.
My apologies. Yeah, in the early days of the Wuhan crisis, a lot of people died at home. This is what we learned from reading the social media. People put a lot of stories onto the social media at that time, and so they were not recorded as a COVID-19 related death, and some actually the government did not have enough test kits. So they died in the hospital. They were not diagnosed as the COVID-19 related. So the early days, a lot of inaccuracies, definitely a lot. I think a week or 2 weeks ago, the Wuhan government revised the number of deaths. I think they reached to 50% higher than before. But I don't think this is still not accurate. I think as the process going on, when more information is gathered, there might be more revisions of these numbers. That's my guess.
Thank you. Several questions coming in. First, to Dawn, can you explain governance?
Not in 30 seconds, I can't explain governance. I simply want to suggest that there is a normative dimension to governance, right? How democratic you are, how authoritarian, and so forth. And depending upon your values, right, you can be a Democrat or an authoritarian, I suppose. And then there's the empirical side, which deals with questions like corruption, like efficiency, like effectiveness, right? The timeliness of decisions, right? And it seems to me that insofar as you can separate governance from the normative issues of democracy versus other systems, other types of regime, we can agree that governance matters a lot. Now, the difficulty is that you don't want to reduce governance to a pure matter of technique, whereby if you had all the algorithms in the right computer, then human beings wouldn't even have to be involved, right? Except they're the ones who write the algorithms and who bias the algorithms, depending upon what their own values are, which they all too often intend to insert into the program, right? So that's the difference I'm talking about. In other words, those who argue that it's all about governance make a useful point, because the evidence on democracy versus authoritarian rule is, let's say, the judgment is still not in. We don't really know. We'll see in retrospect. There will be stories and histories and so forth written about this. But for the time being, I am agnostic on that question. But I'm not agnostic on the importance of governance, whether it's surrounded by a democratic regime or a more authoritarian one.
Thank you. We're very close to time. The final two questions I'll throw out there. One, any guesses about what's happening in North Korea? Officially, they claim none. Another question about comparing contact tracing in China, Korea, Singapore, and elsewhere.
I'll just briefly remark on contact tracing in South Korea, and I think it might raise the point who owns that information. These are information, so it was credit card data, personal credit card consumption data, where they spent their money, cell phone data, basically if you move around the cell tower, locate the information, and then video data and interviews. And these data are owned by, so the credit card companies, our data is owned by the private company, cell phone data by the cell phone providers, private companies. So in some sense, these are data that even researchers or local governments can try to access by purchasing these data from the company. And I think what the government did was to facilitate sharing this data through the system. So the government does not own the data, but try to facilitate sharing this information so that, supplying and allowing app developers to access them. So the apps are all different as well because they have different technology and skills. So it was different in that regards. And after 2 weeks, they decided to disclose, not share a lot of these information because after 2 weeks, it's not that useful.
Any comments about what's happening in North Korea?
I'm not sure we really know what's really happening in North Korea. I mean, there are some conflicting reports or information about North Korea. But it's really hard to imagine that there's no case in North Korea because even though they shut off the travel early on, still there's a lot of movement between China and North Korea. And there's some people saying that there are some cases reported, but officially they deny. So I think at this point, we can only speculate. And I'm skeptical that there's no case in North Korea.
Well, thank you all very much for joining us. We are at time. I will turn it back over to Gi-wook to wrap up.
All right, so thank you so much for joining us today. And as I said earlier, we have ongoing series on COVID-19 in Asia. So please check our website for more details and registration. So thanks again and have a great weekend. It's a nice weather outside, so please enjoy your maybe activities outdoor. So thank you.